Good day, everyone. This is Dr. Yakub, Wildlife Hospital again. Today, we're here to talk about something related to women's health, and that is breast cancer. Now, breast cancer is the commonest cancer among women globally, all over the world. And as of 2022, according to WHO, over 2.3 million women had breast cancer globally in 2022, and over 600,000 of them died that year. That's to tell you how bad it is. Now, breast cancer incidence seems to be higher in developed countries as compared to developing countries. Maybe the reason is because they have better diagnostic facilities. However, deaths from breast cancer seems to be worse or more in developing countries as compared to developed countries. And the reason for that is the fact that in the developed world, they tend to detect breast cancer earlier. An early detection as compared to the developing world where most women present very late. So an early detection is one very important factor that determines survival, okay, in breast cancer, survival from breast cancer. So therefore, there are a series of recommended screening procedures or processes, and the aim of which is to catch the breast cancer early enough so that the woman does not eventually develop the advanced stage that may take her life. Now, there are standard screening procedures. The most sensitive and recommended screening procedure for breast cancer is mammography. Mammogram is one very sensitive, but however, it has its limitation below the age of 40. For women above the age of 40, mammogram is the best way we can screen for breast cancer. Below 40, breast ultrasound scan is the way to screen for breast cancer. However, it's not every woman, especially in the developing world, that has access to some of these screening modalities. Mammogram, ultrasound scans are not things that are easily available everywhere in the developing world. So therefore, there are other ways that women are encouraged to screen, one of which is what is called breast self-exam. Now, breast self-examination is where the woman examines herself and becomes aware of her breast to the extent that if and at any point she notices changes, she is encouraged to report to health caregivers where appropriate screening should be done. So it is not meant to replace the clinical examination, for instance, but it is meant to encourage the woman so that she becomes aware of any changes and report early enough. Okay, so how and when should we do the breast self exam? For women who are still seeing their periods monthly, it's encouraged that every month after your period, you examine yourself. Now, women who have passed the age of menses, that is menopausal women, incidentally, it is in them that breast cancer is commoner. But I must mention here that breast cancer occurs in any girl child who has attained puberty. That is from the moment of puberty all through her life, she has a risk of breast cancer. So it is encouraged that all through the woman examines herself. So those who are postmenopausal were encouraged to check themselves monthly around the same time every month. Now, how is it done? Very simple. The woman is encouraged to observe herself in a mirror standing. Usually, it can be done standing, it can be done lying down, but the first inspection is supposed to be done standing, either with her hands by her side or above her head, such that she looks at her breasts directly and compare both sides and see if there is any skin changes, if there are any skin changes, if there is any color discoloration, either too much color as we call darkening, or hypopigmentation or lightening that is not appropriate, or see skin retraction or dimples that are not appropriate, or see swellings that are not appropriate. All of these things that the woman will see when she looks at herself in the mirror, and then thereafter she is encouraged to report such changes to her healthcare giver so that appropriate screening modalities will be taken up from there. Now, apart from examining herself in the mirror, the next is to touch herself with the palm of her hands. Of course, what is encouraged is the woman can lie down or can stand while doing that. The right hand examines the left breast, the left hand examines the right breast. Now, what she is supposed to do is to use the palm and firmly press on the breast and rub against her rib cage, the chest wall, to feel for any swelling or lumps that may be there. And once she is able to do that and goes round and all the way to her armpit, if she feels anything unusual or abnormal, she should not panic. She should not make self-diagnosis of anything, but report immediately to a health facility where subsequent and appropriate screening modalities will be undertaken. Now, I must say this, that the reason why breast self-exam is now removed as a recommended practice for screening breast cancer is the fact that it's been shown that a lot of women may have examined themselves and they still miss certain vital things. And so therefore, even when the cancer starts, they may not feel it and they still wait behind until it is too late. That is, and then the second aspect is the fact that some women examine themselves and then panic unnecessarily for things that are otherwise normal. And so anxiety sets in when ordinarily it should not be so. And so it is necessary for us to have it at the back of our minds that breast self-exam may help the woman to be aware of her breast so that if when she feels anything unusual, she is encouraged to report to a healthcare facility and do the necessary appropriate investigations. Otherwise, she should not panic. She shouldn't panic because more often than not, most of the lumpy things that women feel that they consider a cancer are not cancers. Maybe they're normal breast tissues. But the only way a woman will know normal from abnormal is if she familiarizes herself with self-examination to the extent that she knows what is normal and what is abnormal. Now, in the event that you are not too sure, you feel some things and you don't know whether this is normal or abnormal, then it is important that you go to a hospital or to a healthcare giver or professional who will examine along with you and tell you. We call that clinical breast exam. Once he or she examines you and tells you it's normal, you examine yourself again and feel what is normal. Thereafter, you know what is normal, and then you can use that as your baseline and subsequently examine yourself. Importantly, at any point you feel something is abnormal, please report appropriately so that you can be screened and then the appropriate things are done. Thank you very much.